we're going to look at respiration and the anatomy of the respiratory tract. To begin, we're going to define the different types of respiration. The first is called ventilation, and you may have heard of this term before. For example, somebody may be in the hospital and they're on a ventilator. That would be simple breathing, the movement of air into and out of the lungs. External respiration is a little bit more specific. This is the exchange of gases between the atmosphere and the bloodstream. This usually happens inside of the lungs. Internal respiration, then, is going to be the exchange of gases between the bloodstream and the tissue. And the last type of respiration we've looked at in the beginning of the class, it was called cellular respiration. And this is the process by which we use glucose and oxygen to make carbon dioxide, water, and ATP. There are a couple different respiratory tracts inside of the respiratory system. The first is the upper respiratory tract. So you may have been to the doctor and they had said, you have an upper respiratory tract infection. Most likely you have either a cold or a sinus infection, something like that. The structures that you'll find inside the upper respiratory tract include the nose. There's an external nose versus a nasal cavity. The external nose, of course, is the thing that sticks off of your face. The nasal cavity, then, is, well, for lack of a better explanation, the place that you pick. What does a nose do? Well, one thing the nose does is has the ability to smell, so it recognizes stimuli for olfaction. It filters. The little hairs inside of your nose are there in order to filter out particulate matter that you breathe in. It resonates. There's some structures inside of the nasal cavity called concha, and they're there in order to let the air kind of swirl around inside of the nasal cavity, get it warmed up and such before it's sucked down into the lungs. And it's going to also moisten that air so that the air that you breathe in isn't always so dry to damage the tissue down inside of the lungs. The pharynx is a big fancy term for your throat. It's basically a common passageway for air and food. The auditory tubes from the inner ear empty into the pharynx. So literally your ear is connected to your throat. Taking a look here, we've got the external nose you can see, as well as the nasal cavity, the inside. And then the pharynx is, again, your throat, or a common passageway for air and food. And you can see also the opening of that auditory tube into the pharynx. Moving down, then, we'd enter into the lower respiratory tract. And if you, again, had a lower respiratory tract infection, this would be an infection that was a little bit more, damaging, let's say, to your tissues. It would be a bronchitis or a pneumonia. So, the first structure in the lower respiratory tract is something called the larynx. The larynx is your voice box. And if you have a hard time finding your voice box, simply find your Adam's apple. That's what we call our thyroid cartilage, and the larynx is right behind that. Functionally, it's going to open the airway with a structure called the glottis. It also helps route food and air with another structure called the epiglottis. Epiglottis means on top of the glottis. This is a piece of elastic cartilage that's going to either close over the trachea or the airway when you're swallowing to direct food into the esophagus, which will go down into the stomach, or it's open when you are breathing so that the air can make its way down into the lungs. The larynx also houses the vocal cords. Therefore, this is where we would have the ability to create sound. Moving down from the larynx, we'd get into a structure called the trachea. You may have heard the trachea commonly called the windpipe. It is composed of some C-shaped cartilages that hold it open. This serves a couple purposes. First of all, we wouldn't want to have to expend any energy to open up our airway since we are always breathing. And the reason that the trachea has C-shaped cartilages, say, versus having complete rings is because posterior to the trachea we have the esophagus. That's the tube that's going to take food from the mouth down into the stomach. And then directly behind that we have the vertebral column. The esophagus is collapsed at all times for the most part unless you're swallowing something. And when you do swallow, it needs to expand. Since it cannot expand posteriorly into the vertebral column because of the bone, we allow it to expand anteriorly into the trachea, thus the C-shaped cartilages and not complete rings. The trachea is also lined with cilia. There's lots of cells lining the trachea called goblet cells. They produce and secrete mucus, and all day long they trap particulate matter and foreign substances inside of the mucus. The cilia then is there to beat and move that mucus back up towards the mouth, where you can either spit it out and get those materials out of your body, or you can swallow it down and your digestive juices, say in the stomach, will take care of them. Additionally, you have a cough reflex in the trachea, and that removes unwanted material. So in the event that you aspire some food, let's say, down into the trachea, you will cough and cough and cough in order to remove that unwanted material. Again, taking a look here, you can see the epiglottis. If you look for the tongue right behind it and inferior, you can see that epiglottis that directs food either down into the esophagus or allows air to move into the trachea. The larynx is the Adam's apple right out front. And you can see the two slits inside of the larynx. Those are the vocal folds. And then the trachea anteriorly as well. This is just a picture of the larynx itself removed. You're looking at a posterior view. So at the top you can see the epiglottis. And the picture on the left, the glottis is open. The picture on the right, the glottis is closed. And flanking either side of that glottis, you can see the vocal cords. And then, of course, just below that is the trachea as well. This picture shows the entire structure again. You can see the trachea a little bit better in this picture, moving down towards the lungs. And the last thing here is the posterior side of the trachea, where you can see the smooth muscle in the back so that the rings are only C-shaped. Some of that smooth muscle will also help determine the rate and force at which materials are moved through the trachea. Say if you wanted to speak louder, or if you wanted to, really force some air past those vocal folds. This picture shows you on the left nice healthy cilia on the surface of a cell. The picture on the right, B, is lack of cilia, almost complete lack of the cilia on the surface of the cells, and that's a smoker's situation because cilia not only is paralyzed by smoking, but eventually the tissue is damaged as well. All right, now as the trachea moves down into the lungs, it's going to branch. The branching of the trachea would be called the bronchi. So these are tubes that branch into the lungs, thus the name bronchitis being an inflammation of the bronchi. As those tubes continue to branch further, they become bronchioles. So these are smaller branches of the bronchi. They just continue branching until we get directly into the lungs. Now, the lungs are lined with some membranes. The membranes lining the lungs are called the pleural membranes. So anytime you hear pleural, think of lungs. There's two types of pleural membranes. There's a visceral pleura. Visceral pleura lies directly on the surface of the lungs. And then there's a parietal pleura as well. The parietal layer is going to be lining the pleural cavity or on the body wall. In between the visceral pleura and the parietal pleura is a pleural cavity or a perpetual space, and inside of there is going to be the lungs. The lung lobes are going to be different on the right lung versus the left lung. The right has 3 lobes and the left has only 2 lobes. Part of the reasoning there is because the heart sits off to the left a little bit in the thoracic cavity, so in the chest. Therefore, the left lung is smaller and has fewer lobes than the right lung. You can take a look at this and see the trachea moving down, branching into the bronchus, and then that continuing to branch into bronchioles. On the right, you can see that there are 3 lobes to the lung, and on the left, you can see that there's only 2. And there's that notch there that's kind of cut out where the heart would sit to give you an indication of how much space the heart actually takes up. This picture shows you a little bit clearer in the blow up on the right, the different membranes. So you have the pleural membrane lining the parietal pleura actually lining the thoracic cavity, and then you have the visceral pleura attached directly to the lung, and then inside of there you'd have a pleural cavity. Now, as those bronchioles continue to branch, they're going to eventually end up in structures called alveoli. These are air sacs in the lungs where gas exchange takes place. They are lined with a fluid called surfactant. The function of surfactant is to reduce surface tension and keep the alveoli from collapsing. Alveoli kind of look like a little bunch of grapes, and what happens is that the fluid inside of the lungs really causes the lungs to want to collapse. And with this surfactant, the surface tension is reduced and the lungs stay open and ready for gas exchange. Now, infants that are born somewhere between the, I guess I should say fetus, that are born early, before, say, the 7th month, don't produce surfactant. And that's one of the biggest problems with premature babies, is getting the surfactant and allowing their lungs to exchange gases. Now, since the alveoli are where the gas exchange is going to take place, of course, we've got to have a blood vessel there as well. So the alveoli are going to be wrapped up with what we call pulmonary capillaries. They surround the alveoli and participate in the external respiration, or the exchange of gases, with the atmosphere and the bloodstream. Taking a look here, you can see how I had mentioned that the alveoli kind of look like bunches of grapes. And on the inside there, we've got the picture blown up at the bottom where you can see the capillaries are wrapped around the alveoli, and that's where the gas exchange takes place. So we've got one layer of epithelial cells, a simple squamous epithelium for the alveolus as well as for the capillary. Therefore, these tissues both function in diffusion.